I mean, in the hospital, just about everything has changed. I think the greatest, from an intensive care unit perspective, the obvious thing is the acuity and volume. So the patients are so sick with COVID-19, and the volume of them has been so high. It's like nothing we've ever experienced before. But from a practical perspective, I find that the communication with families is incredibly difficult. A lot of these patients end up on a mechanical ventilator. They're sedated. They can't, they're not capable of interacting with us. And so we're forced over the phone or via FaceTime to communicate with the family members. And it was, there was an adjustment period there, partly because it's just part of critical care is also being able for the family members to see, actually physically be able to see how sick their loved ones are. And when you're completely disconnected from that, I think it's hard for them to really understand and gather how sick they are, even though we're trying to express that to them until you see it with your own eyes, the old picture's worth 1,000 words or whatever. And so we quickly realized a few days into it that let's get some iPads and let's leverage anyone who has Apple or anything, something like we're using today, just to be able to show them their loved one and give them also an opportunity that even though we tell them, they're on sedatives, they may not truly be able to hear what you're saying, but talk to them as though they can hear you. And it's gone really, really well.